Welcome to Health Matters. I'm your host, Kareem Amiri. Today on the Health Matters podcast, I'm joined by Jenni Ross, Director of Experience Strategy at Wellmark. She's here to discuss the member experience and talk about her team, how they focus on members, how members interact with Wellmark every day, and from a digital tools to service experiences, and the work that you're doing to improve those touch points as they evolve over time. So before we jump in, can you tell us a little bit about what you do and your team does at Wellmark?
Sure. Well, we are the member experience team, as you mentioned, and our job is really to listen to our members and understand what their needs are so that we can determine how and in what ways we can improve their experience. So that could mean that we are changing what we're doing on the web. It could mean that we're changing maybe some of the ways that we are meeting people when they call us or when they send us a message, or the mail that you receive as a member. So all of those touch points are available for us to alter their journey to ensure that they are having successful healthcare journeys with us and having a pleasant and trustworthy experience with Wellmark, right? So that's what we're after.
Well, to kick us off, can you share a little bit about how the member experience has been evolving recently and what members might notice that's different when they go onto the member portal, myWellmark?
Sure, absolutely. So quite a few things have changed on the member portal lately. Firstly, you'll probably notice that we've reflowed the entire navigation in hopes to make things much easier to use and make the app more intuitive. We've also updated the look and feel, so it's going to look and feel more fresh, more modern, a bit different than maybe what you were used to in the old app.
So I heard that we won some awards for all of that.
We did. We won a gold medal from Corporate Insight. They benchmark things in the healthcare space for our experience for mobile coverage and health information.
Wow, that's fantastic. And what specifically, were they focusing on in those two categories?
Yeah, there were quite a few contributing factors to that. One of them is our digital explanation of benefits, or EOB. Making that available online, and then also redesigning our claims page so that you see infographics on answering that key question that people have at that moment in time. Where did my money go? And what do I owe? What do I need to pay? Where did the money go? So the graphics that we created break things down and say, this went to your deductible, this went to your out-of-pocket max, this was your copay, to make it very simple and very clear to answer that key question of where did your money go?
Awesome. And I think there's some new spots on the website, too, around behavioral health and maybe virtual visits.
Yes, we also have some excellent new resources available for members. Again, our goal within the member experience team is to ensure that they have a successful healthcare journey, kind of no matter what it is that they are working through at the time. So all of our members have access now to a resource center that allows you to understand what behavioral health resources are available to you. It breaks down kind of where you can seek providers in that space, and then gives you access to educational materials and even the ability to take some quick quizzes to understand what resources might be best suited for you. Yeah. So that is a big improvement that we've made in that space.
And that's stuff we've talked about before on the podcast, so that it has been well received.
Good. I'm so glad to hear that. And then our member feedback has said the same thing. It was a big area of kind of uncertainty and confusion for folks that we wanted to make sure that we addressed really well. I think another one that we've heard from members lately is around virtual care and understanding, if I want to see a provider, what are the options available to me if I want to do this in person or if I want to do this kind of over my phone via an app? And how do I know what available options I have as part of my plan? So one of the big changes we made to the provider finder was allowing all of the virtual health providers to be called out specifically and then promoted if you have that specific benefit on your plan.
Yeah, on both of those topics, I know I've heard positive feedback, just making it easier to try and figure out where you need to go for those services. That really leads me into my next question. I know as my team and myself encouraged employers to encourage their employees to sign up for myWellmark or sign up for the member portal. In your mind, why is it so important to, do that digitally or have that digital experience?
Yeah, I think that there are a couple of key reasons. It's an easier experience. You can access it at any time, so it is always available to you. Self-service is 24/7, so you don't have to take time out of your busy day to call. You can have a one-stop shop for everything that you need to manage your benefits or to understand your care. The online experience is also a little bit faster than like paper. Right? Think about that. You don't have to wait for an EOB to come to you in the mail. It's available to you online the minute that it's been processed.
There's been a lot of conversation around this concept of digital opt-in or group digital opt-in. Can you share what that is and what Wellmark is doing toward in that space?
Yeah, absolutely. So group digital opt-in really allows any of the groups to opt their entire member population into digital communication. And so what that would mean is they would get an invite to opt in, sign up, get your account established with us so that you can be onboarded digitally into the mobile experience or into the web experience.
Okay.
And so it allows you to start off from the very first time you get access to your plan, doing that in a digital way so that you get all of the robust features and benefits of that online experience instead of having to make a transition from paper over to the web. You'll just start there and have access to all these features and functionality that really enhances there.
Is that live yet? I know we've piloted it, but...
We have piloted it.
Yeah.
We are hoping for it to be live to all groups by the end of the year. So that is what our goal is. So it is coming. So for groups that are interested in getting their members all set up with all the features and tools available to them, this is coming your way. It comes to a theater near you.
Sounds good.
Yes.
So we'll be ready to talk about it, and employers can ask about it later this year.
Yes.
Good deal. So as you're well aware, and I know our audience is well aware of this too, companies are really looking at AI and how they can utilize AI. In your mind, how is you and your team, you're thinking about AI and how you can utilize that in the work you do?
Yeah, that's a great question. So we view AI as assistive to people. Ultimately, AI exists because people can use it to be more productive or to solve problems that maybe they can't do or don't have the time or resources to do on their own. So it allows us to deploy things for our members that allow them to solve key problems. So as an example.
Okay. I was just about to ask you. Can you tell me a little example of that? As
an example. So when we were doing research with members about how they think about their benefits, we came across a phenomenon where people would be describing the same benefit with wildly different language. So in our effort to translate that, what we ended up doing was creating an AI model that allows us to let our members use whatever language they naturally want to use and input that into a benefit search where it will return all relevant benefits, regardless of how they describe things. Okay. So as an example, we've heard people would call things, maternity benefits or pregnancy benefits. And so you can put in whichever term appeals to you and makes sense to you, and you'll get all available benefits returned to you.
Okay.
So then that way you can understand better what it is that you're looking for, and you can also see the totality of anything that may be relevant to what you were looking for.
Yeah, that's great because sometimes you don't really know what you need. You're grasping at it, and this can help you get there faster.
Yes, it'll consolidate information for you faster and also make sure it's relevant to you based on what you've asked for.
Awesome. When you look ahead, what are your overall goal for member experience at Wellmark?
I think overall we're going to continue to listen to our members. So our goal is to keep understanding needs as they evolve. We know, especially with digital technology, AI, like you mentioned, needs are not stagnant, right? We have to continue to listen, continue to evolve, continue to have empathy as the world changes and as members' needs change. We have to keep up with that. So our main goal really is to make sure that no matter what's going on, we're still providing you what you need from us in a way that's easy, accessible, and intuitive.
That's great. We're kind of running at the end of our time today, but before we sign off, is there any last thing you want people to know about the member experience at Wellmark?
I would say a couple other key features I just want them to be aware of that are really helpful. So we talked about kind of onboarding into that digital experience with group digital opt-in earlier. One of the key things that we've just made available is the ability to put your ID card into your digital wallet. so you can put it into your
I've done
Apple
that.
Wallet. Have you done it?
I've done it, yeah.
I think like 6,000 people have done it. So good.
Yep.
I'm glad to
Told
hear
my
that.
kids to do it.
People
Well,
are
it's in
doing
my
it.
wallet, so my kids have it too.
Good. It's always on you, right?
Yep.
Everyone always has their phone on them. Of course, you would want to be able to store it there.
Yep.
So that's creating additional accessibility for folks so that they don't have to carry a bunch of things around with them, and it's always available. So I just wanted to make sure that you guys knew about that. I think the other thing is I would like to remind folks to opt in for digital EOBs. I think that's another thing that's helpful. You'll get access to them faster. You don't have to wait for the mail. And then you get that really cool breakdown online. So I was a little plug for that, a little advertisement if I could.
Well, Jenni, thank you so much for joining me today. And thank you for all of you for tuning in to the Health Matters podcast. We hope that you found the information valuable and insightful. And if you enjoyed today's discussion, please subscribe to the Wellmark YouTube channel. And we hope to see you next time.